The Sjogren syndrome. According to the 2008 National Arthritis Data Workgroup report on the prevalence of rheumatic diseases, the number of Sjogren's patients without an accompanying major autoimmune connective tissue disease ranges between 400,000 and 3.1 million adults, with the prevalence increasing to twice that number when patients with another related disease are included. Using a multidisciplinary team approach and communicating with different medical disciplines is crucial for optimum therapy for Sjogren's patients. Swedish physician Henrik Sjogren documented a group of ladies with severe dry eyes and dry mouth in the 1930s, many of whom also had chronic arthritis. Rheumatologists now know more about the disease named after Sjogren and can advise patients on how to live with and treat it. What is Sjogren syndrome? Sjogren syndrome is a systemic, autoimmune, rheumatic disease that can affect many different body areas, particularly the moisture-producing glands, causing widespread dryness and other significant complications. Dryness can occur in the nose, sinuses, ears, throat, skin, and, in women, the vagina. There is speculation that the prostate, like other organs, may be impacted in males with Sjogren's. These issues can have an impact on a person's job, social activities, and overall quality of life. Patients may experience irritation, a gritty sensation, or intense burning in their eyes. Untreated dry eyes are more prone to infection and corneal damage. A dry mouth can make it difficult to eat and swallow dry foods. It can cause dental cavities, chipping, breaking, and tooth loss. A dry mouth can worsen gingivitis, gum inflammation, and oral yeast infections, candida, both of which can cause pain and burning. Sjogren syndrome commonly results in swelling of the parotid glands, the glands below the ears and running along the jawline. Dryness can make infections in the lungs, sinuses, vagina, eyes, and mouth worse. Sjogren syndrome can also affect the joints, muscles, neurological system, including the autonomic nervous system, gastrointestinal tract, including the pancreas and liver, skin, blood vessels, lungs, and kidneys. Even in those who do not have rheumatoid arthritis, joint pain and stiffness with minor swelling are typical. Rashes, including inflammation of tiny blood vessels, vasculitis, may develop, most typically on the lower legs. Sunburn is common on the back, chest, face, and arms. Numbness and tingling, particularly in the feet, are common signs of peripheral neuropathy, and they typically precede feelings of dryness. Symptoms such as fatigue, cognitive impairment, and sleep disturbances are frequently noted. Patients should also be watched for signs of despair and anxiety. Several autoimmune connective tissue disorders, such as systemic lupus erythematosus, rheumatoid arthritis, scleroderma, autoimmune thyroid disease, antiphospholipid syndrome, sarcoidosis, and celiac disease, can coexist with Sjogren's. It is sometimes confused with fibromyalgia, multiple sclerosis, and a novel condition called IG4-related disease. What causes Sjogren syndrome? The cause of Sjogren syndrome is unknown, however, it is an autoimmune illness. This shows that the immune system, which normally protects the body against malignancies and viruses, is attacking its own tissues. A marker for and/or contributor to this process is the production of aberrant antibodies, called autoantibodies, in the blood that respond to self-proteins. The decrease in tears and saliva occurs when the glands that produce these fluids become dysfunctional and damaged due to inflammation and lymphocyte infiltration. According to research, hereditary factors, and sex hormones, when paired with an environmental agent such as a viral infection, may cause the condition to develop. How is Sjogren syndrome diagnosis made? A combination of symptoms, physical examination, blood tests, and special investigations to check for objective evidence of dry eyes and dry mouth is used to make a diagnosis. Specific testing can detect drops in tear or saliva production. An eye examination with vital dye staining of the cornea and conjunctiva aids in the detection and assessment of damage, i.e., dry spots, to the outer surface of the eyes caused by dryness. Blood testing can detect autoantibodies, which are common in this condition. Antinuclear antibodies, ANA, anti-SSA, RO, SSB, La antibodies, and rheumatoid factor are examples of common antibodies. When autoantibodies are lacking, a biopsy of the small salivary glands, typically collected from the inner lower lip, may be utilized to make a diagnosis. When compared to older adults, children, and young adults frequently show various signs and symptoms of Sjogren's. The most common initial symptoms are enlarged parotid glands and arthralgias, joint pains. Neurologic and renal symptoms may also occur in the pediatric population. Dryness characteristics may or may not be present at the time of diagnosis. How is Sjogren syndrome treated? There are currently no FDA-approved systemic immunomodulating treatments for Sjogren syndrome. Hydroxychloroquine, Plaquenil TM, an antimalarial medication, may be beneficial in some Sjogren's patients by reducing joint discomfort, exhaustion, or rash. Patients with systemic problems, such as fever, severe rash, lung disease, neurologic problems, or kidney involvement, may require corticosteroids and/or immunosuppressive drugs such as methotrexate, azathioprine, Imuran TM, mycophenolate mofetil, Cellcept TM, leflunomide, Arava TM, or cyclophosphamide, Cytoxan TM. Biological treatments, such as rituximab, Rituxan TM, may also be employed, particularly in severe illnesses. Dry eyes typically respond to artificial tears administered throughout the day or ointment applied at night. Additional procedures, such as the ophthalmologist plugging or blocking tear ducts, can be utilized in more severe situations. Eye drops that reduce inflammation in the glands surrounding the eyes, such as cyclosporin, Restasis TM and Sequa TM, and Lifeitgrast, Shidra TM, may alleviate symptoms and minimize the need for artificial tears. Drinking water, consuming xylitol-sweetened gums and candies, or using saliva substitutes can all help with dry mouth. Prescription drugs that promote saliva flow, such as pilocarpine, Saligen TM, or cevimeline, Evosac TM, benefit many patients. Antifungal medications may be required if individuals develop yeast infections. Nasal saline irrigation and humidifiers may help relieve nasal dryness. Medicines that lower stomach acid, such as proton pump inhibitors and H2 blockers, may alleviate acid reflux symptoms. To avoid cavities and tooth loss, all patients should receive regular dental care. It is well known that fluoride, which the dentist provides in the form of prescription-strength toothpaste or varnishes, helps to prevent these problems. People with dry eyes should see an eye doctor, an ophthalmologist or an optometrist, on a frequent basis to check for symptoms of corneal damage. Infections should be checked in patients who have severe redness and pain in their eyes. Watch us on YouTube and subscribe to learn more about the autoimmune disease. And online at www.newstoday.nyc.